asked me to talk about the depth of this whole issue. Do you feel like that I've made it clear where I feel, how I feel on that? I don't see it in the bill. Okay. Yes, ma'am. Behind you, I'm with the lady.
Is there any effort in Congress to change the law so we can all buy health insurance like we buy home insurance and car insurance? And then there would be a lot more, then there would be a lot more competition, and we wouldn't be tied to corporation jobs or anything. We'd all be independent buying our own insurance. And then, as I understand it now, you can't buy health insurance across state lines.
There are bills that propose that because of the states' rights issue, and because every state offers a minimum policy that has to have certain things in it. Those policies are going to have to stay inside of state units, in my opinion, or states that have similar laws. I don't think we can go to a system like you described, where just basically everybody gets a check and you go out and buy your insurance from whoever you want. I think that is being proposed by several Republicans that happened. There's a resistance by all American people at this point to mess with the health insurance that they've got. And we've got to try to do something that doesn't mess up 250 million people's insurance and provides a health care. Yes, sir.
Were you in the legislature in 1999?
In 1999, when George Bush signed the Texas Advanced Directives Act. And if you were, would you explain that act? It's also known as the Medical Futility Act. Would you explain that act?
I don't know that I can explain that.
Well, I can explain
My
that.
memory is that good.
In Texas has the Medicare Futility Act, which allows physicians, in collaboration with the medical ethics boards of hospitals, to make a decision on end-of-life care if the family have a dispute and they're not sure what to do with Granny, who might be on a respirator. So what happens is the physician says that there's futile chances of that person regaining consciousness or living a substantive life, that they can make a decision to withdraw treatment, and then it goes to the Medical Ethics Committee, and the Medical Ethics Committee either sides with the family or the doctor. They make a written report. You have 10 days from that time that written report is given to find another hospital to take care of your loved one if they so do choose to do so. That's a law that's in the state of Texas, and a lot of people like that law because it kind of takes it out of the hands of the court. Because otherwise you have to go to court, you know, to sustain life. I mean, we saw what happened in the Shivo case, for example. So this is a law here in Texas, and it's really a very good idea that you have a living will. And that's why they ask you when you go to the hospital, do you have a living will? Because otherwise, the doctor and a medical ethics committee that you know no one on is going to make that decision. And that's law.
Thank you. I did not remember that. I appreciate you informing me stuff. Yes, ma'am. Then I'm going to go to you back here.
Hello, my name is Kathy Hastings, and my point is that the insurance company and the government have all this wonderful paperwork for all the doctors to fill out, and the doctors have to maintain these staffs to know all the different rules for all the different insurance companies and for Medicare, and it costs them money. And if you look at what the doctors are actually getting, when they treat you, they're not getting what they need in order to sustain them. Now, I'm not a doctor, but I don't think this is right, and I think that any sort of healthcare reform should go towards the money going directly from the person getting the care into the hands of the healthcare provider. And some of the doctors have come up with new ways in order to handle this. If you need to have, if you need You can't take big payments, you need to spread it out. They'll give you some sort of an HMO where they will see you for basic stuff, and you pay like a monthly fee or a yearly fee. So, you know, there's ways in order to handle this. Personally, I think that we have kind of gotten away from realizing how much healthcare costs on our own, and if you go to a doctor and we don't have insurance, you'll find out because they'll charge you a lot of money for a single visit. So we're kind of insulated from it, and we need to pay them what they need in order to stay in business. So we will have our doctors, and we should be willing to come up with something out of pocket, whatever plans we're talking about, say up to 3% of adjusted gross income, which is where you get a break on your income taxes for health care, that you have to pay 100% up to that. And then over that, then you can get some sort of insurance if you want, or if you want to just have catastrophic insurance where you get something that's going to cost you $2 million, that, you know, somebody will pick it up. And there aren't that many $2 million procedures or treatments that are out there. The cost of health insurance would go down, the doctors would get their money, we'd cut out a lot of these big insurance fat cats as you're talking about. We would cut out the government, which we know whatever they take over, it seems like there's a lot of money that gets lost along the path. You know, it doesn't get to where it really needs to go. So that's my ideas on healthcare reform. The other thing that I would like to say for these committee members is that I've become politically active lately. I haven't been federally active before. I've been involved with city council stuff. But when people are sitting on committees, if you don't have a representative on that committee and you need to put some input into the committee, that the committee members are working for the good of the United States. They're working for everyone. Everyone becomes their constituents. When they vote on the floor of the House, they can vote however they want on the floor of the House for the constituents, but when they're in committee, they need to consider the welfare of the total United States. And that's all I have. Thank you.
Thank you.
Congressman, first I'd like to thank you for taking your time to come here and listen to us and answer our questions. A lot of your colleagues don't have the ability to do that, or don't have the guts to stand up to their constituents like you do, sir. And what say you, sir, to President Obama, Speaker Pelosi, and the House and the Senate Leader Harry Reid's position that no matter what the Republicans do, they will pass this bill, and they will do it no matter if you come on board or not. And second, sir, true healthcare reform in this country can only come from tort reform and the portability of insurance across state lines. That's how it becomes affordable, and you get the lawyers out of healthcare.
One thing I'd like to say is that I do not understand. The bill goes into effect in 2013. Okay? We do not understand why there isn't adequate time to sit down and begin. Why did the bill have to be introduced one night and passed out of committee the next day? Why did the bill have to go to the floor immediately before we had a chance to read the bill?
Because it stinks.
The bill isn't going to go into effect till 2013. We've got a little time to take every one of your ideas and try to put it inside the bill and try to make this a better bill.